I'm AC Pradeep, a diploma student of nursing following at International Institute of Health Sciences. My research topic is awareness of STD, HIV and AIDS among adults in Sri Lanka. These are my content. I'm going to talk about introduction, objectives, methodology, research, discussion, recommendation, and references. Introduction. When it comes to HIV, STD and AIDS awareness in Sri Lanka, with a population of 20.5 million in Sri Lanka, has been classified by UNAIDS as contributing low level in HIV epidemic, low level HIV prevalence in epidemic area. With a national HIV prevalence of less than 0.1, they have classified, and that is non-generalized across the population. According to the Joint United Nations Program on HIV and AIDS, it means UNAIDS, and the World Health Organization (WHO), they have estimated that 4,100 adults, it means less than above 15 years old, were living with HIV and AIDS among in Sri Lanka, and at the end of the year 2011. But when it comes to 2015, they suggest that the people who live with HIV and AIDS in Sri Lanka, it will be more high. Normally, the male to female ratio among HIV positive persons in Sri Lanka is nearly 3:1 ratio, and the proportion of eligible people receiving antiretroviral therapy at the end of the 2011 was between 20 to 39%. HIV is mainly transmitted through heterosexual sex, according to accounting for 82.5% to total cases. But they have said that the normally homosexual people and bisexual people are the key population who has mainly high risk. So normally WHO they have mentioned that they have estimated that there are 2.5 million new HIV infections in globally in every year. According to UNAIDS, the estimated number of people living with HIV in Sri Lanka, as I previously said, 6,790, and people who has STD infected, 18,975. So as you can see this chart, they have counted and mentioned end of 2014 fourth quarter, there were 5 AIDS deaths reported, and 2,074 people who has got HIV. But when it comparing to 2015, still they are showing the results of the third quarter. Normally, that amount has increased to 2,241. When it comes to STD infections, you can see there are a lot of STD diseases. They have mentioned from beginning to HIV to non-STI contamination. Its total, when it comes to HIV positive people in Colombo, in Sri Lanka, totally 106 people they have estimated, but these statistics are according to Sri Lankan government killing statistics. And AIDS people, there are 20. Normally they have mentioned syphilis, gonorrhea, and chlamydia infection. The statistics shows that by years 2014 to 2015, the amount is gradually increasing. My research topic I chose because when I look at these research findings, it shows that there are gradually increasing HIV infections. So I wanted to assist the awareness of STD, HIV and AIDS among adults, as well as the awareness signs, symptoms and complications, the awareness transmission methods and the prevention methods, the awareness of treatment option, the behavior and attitudes regarding STD, HIV, AIDS, as well as the level of sex education. My research methodology was, study design was a descriptive quantitative study. My population was rural, urban and suburban people from Sri Lanka. Size was randomly chosen 150 adults. Data collection method was self-administered questionnaire. When it comes to result, I have to say that I chose 100 people are from various aspects like lesbians, bisexual, straight, and gay people. So normally it was like male people was 47.6, female also the same, and transgender people there were like 4.2, 4.8%. Age group was 70 to 55. These are my results. I asked them whether they are sexually active or not. There were people like 78% people were sexually active, and from those people, then I asked whether they are practicing safe sex. But from those 78 people, more than 40% people, they were not practicing safe sex. And it's actually a high risk. And 22% said they are practicing, but depend on situation, 31%. It means when they get the chance, if they access to a safe method, they will use. And sexually active people, 78%, from them, there were people who don't know about HIV, STD, AIDS. I mean, I asked about the meaning of HIV, STD, but they were not aware. Sexually active people have taken HIV AIDS test. I asked them whether they have tested themselves in their entire life. But from people who are active in sex, 86% they have never tested themselves. Then my next question was the practicing about safe sex and practicing about safe sex and having HIV tested. Then my next question was about the symptoms and signs about HIV and STD. So most of people, they know about 90% of people, they know about like gonorrhea and HIV. 93% people they aware. But you can see when it comes to diseases like genital tracts, HPV, trachiomonas, chlamydia, they are very less aware about those kind of disease types. And awareness of STD complication, they are very less awareness they have. And when it comes to reason for not practicing safe sex, the people said that due to embarrass, due to the society views, they are not getting to practice safe sex. And when it comes to the question awareness of drug therapy, awareness of pre-exposure prophylaxis, most of people, they are not aware about the drugs and treatment methods. So as well as this slide shows that the testing methods for HIV, STD, this says that 34% they don't know about, 34% and 26% they don't know about the right way of testing HIV, STD methods. So according to these statistics, my conclusion was majority of the participants are sexually active, but they are not practicing safe sex, and there are STD HIV transmission methods in satisfactory level, but they are testing awareness and treatment awareness. They are those things were very poor, and again, the general knowledge about STD, HIV, AIDS, and the knowledge of sexual health remain at very unsatisfactory level. So my recommendations are researchers should be carried out to find out reason for poor level of sex education. Poor level of sex education should be addressed by using appropriate ways to improve public knowledge regarding STD, HIV AIDS. Research should be carried out to find out what are the best methods to prevent less knowledge and improve the awareness. And as well as privacy and confidentiality should be reassured for clients to feel free to visit healthcare facilities. And the main another point is social and institutional and personal stigma against key population should be addressed. Due to the stigma scenarios, most people they are very less active to go to clinically tested and to practice safe sex. These are my references. I especially thank to all IIHS and my supervisor Dr. Nishan Silva and all the participants and Dr. Singh and my colleagues. So if you have any questions regarding my research,